Dr. Nickles joins us, and we appreciate this segment sponsored by him and his dentistry office. We're going to welcome to the show, first
of all.
Thank
you. It's good to be here.
We feel like we know you so well, but there are some people out there who might not know you yet, and they might be looking for a dentist, and that's what we're going to talk about today.
Sure.
Is new patient. How do I make that jump either from somebody to you or just finding a new one?
Take the fear out of the hearts of millions.
You got to take the fear out of the hearts of millions. You know, dentistry has come a long way.
Sure.
And we've entered the 21st century. There's many things that we know we're able to do these days where we weren't able to do. You know, sedation dentistry is probably one of the greatest things that we have to people who have a true high fear, who've had a bad experience in the past. You know, we can bring them in. We give them a little bit of medicine. They go to, you know, sleep. They wake up. It's all done.
So you let
no
them
fear.
They literally can check out. And
they
not
literally
even know
can
what you're
check
doing.
out. Absolutely.
Okay.
You know.
And do you use also, I guess, Novocaine? And you use
yeah, unfortunately, people think if you go to sleep, you know, you have to use you still have to, you know, give the Novocaine.
Yeah.
You know, but the good thing about the sedation is you don't remember it, and that's the best thing.
That's
and because
right.
you're asleep, your body hasn't been stressed, and you don't have the post-operative pain as you would as if you were awake during a procedure.
Yeah, see, that's interesting. I want to underline what you just said. That means that the stress is really what brings the pain on more.
The stress, your body, anytime you're stressed, your body releases, you know, inflammatory type cells, and the inflammation is what drives the pain, you know, process.
You feel very fatigued after it.
Yeah. Because you are, you know, just even if you don't actually feel something, you know, if you're sitting in the chair, even if you're numb, and your mind's sitting there going, oh, this is not good. You know, this is going to hurt, or what's going to happen later.
It is truly.
So you know, power of the mind.
It is that anticipation that is the worst. Sometimes going up the roller coaster is more painful than actually making the quick dive down.
Yeah.
So tell me this: what procedures are okay for sedation? Is it for just the major ones, or even minor?
I will have people come in and have, you know, sometimes we can do sedate and do many appointments. You know, 4 or 5 appointments in one appointment. Oh. So I've had people they'll see. I have one tooth out. I'm afraid I had a bad experience. Sedate me. Yeah. So, you know, anything from a simple, you know, extraction up to, you know, the most complex procedures that we do.
Oh, and we haven't thanked you publicly. Dan granted one of our wishes, one of our dental wishes for 25 days.
Actually getting to see her when I leave here.
Thank you for that.
Thank you so much.
Yeah. Well, now, again, that fear factor, it's always there, but talk about things like floppy dentures and things that there's an alternative to that's gotten really successful.
Oh, yeah. People with loose floppy dentures, there's nothing to hold a lower denture in. It just sits there and it floats around. I always tell people if you have a loose, you know, lower denture, it's going to float like a boat.
Well, silly putty or something. You wouldn't have
they take all these, you know, these fixidants and all this other stuff, and they glue these things in. You got a mouthful of pudding.
By the way, FDA not approved silly putty yet. Try that. Hey, let me.
Jack's Home Dental Care.
But see, that might be a reason that someone wants to switch to you because maybe their office is not offering that.
Right.
What is the procedure of switching from one dentist to another? If you have a good dentist, that's great. Stay with your dentist. But if you're needing to switch for one reason or not.
Just give our office a call, talk to Whitley or Summer, and we'll be glad to get you taken care of. And even if you're happy with your dentist, but he doesn't offer the implant procedures, I have many dentists and patients that'll come over, you know, we'll put the implant in, we'll, you know, lock the denture in, and they can go back to their, you know, previous dentist and they get taken care of there. You know, if they, you know, want a crown with an implant, we'll place the implant and we'll let their other dentist place a crown for them.
How many implants can you do in one visit with sedation? I mean,
I've done 12 before.
One per time?
No, you can do as many as you know, as many as the patient needs. I mean, we might place one. I've placed up to 12 before on a patient.
In one visit?
In one visit, yes.
That's amazing.
You know, so.
Wow. But I mean, you're going into bone, so
you're going into bone.
It's not pain or.
No, the only pain comes from how gentle you treat the tissue.
Right.
You know, you always see people, they would have their wisdom teeth taken out and they swell up like bears. You know, it's because they weren't gentle to the tissue. If you're gentle to the tissue, the teeth will come out.
Dr. Nickles is a gentleman.
Thank you.
He is a gentleman. All right. So, okay, so we know how to switch, which is interesting. I didn't know if you had to grab records and bring them with you, but just show up and you guys take care of it.
We take care of everything.
Okay. If we just are new to the area, we're looking for a dentist, same procedure?
Just give us a call. And usually the first appointment we'll do, we'll bring you in, and it's almost like a get to know you and help you get to know your mouth. Okay. And so we'll bring you in and we'll take a full series of x-rays. We'll take individual pictures of all your teeth. Then we'll take the big one called the panoramics. It goes all the way around, and we'll look at the bone and the tooth structures and on the face, you know, bones of the face. Our, you know, difference is we'll actually take individual photographs We have a camera about twice the size of that, that little pen there. Yeah. We'll actually take individual photographs of all the teeth, of all the surfaces of your teeth, so that you can see what I can see. Because sometimes, I'm trying to show you an X-ray, you're going, what do I see? Well, a picture's worth 1,000 words.
Right.
So I'm going to show you a picture of every surface of your tooth, and we will walk through that.
Lake Forest Shopping Center?
Lake Forest Shopping Center.
Greenville.
Yeah.
Okay. Dr. Nickles, thank you, buddy.
Thank you.
Thank you so much. Coming up, we're going to tell you how you can get some free stuff from Chick-fil-A, right?
Yeah, Harvest Hope. They're in on it. We'll tell you about that in a minute.